This meeting is being recorded.
Good day and welcome to our webinar, Medicare Basics Decoding Annual Enrollment. My name is Andy Furman and I am an independent Medicare plan advisor. I believe Medicare is the intersection of your health coverage and financial wellness. It's your health, it's your wealth. Worry less, heal more. Let's create a partnership for your health and financial wellness. The goal of this presentation is to educate you so that you have a plan for this year's annual enrollment. Annual enrollment runs from October 15th through December 7th, and it's your opportunity to make a change to your Medicare plan coverage. And it's really important this year for you to be using an independent, trained, and licensed insurance broker to help you understand your prescription drug coverage, whether you get that prescription drug coverage through a Medicare Advantage plan or through a standalone prescription drug plan. We're going to review some important terms this year as you review your plan changes. We're going to review those changes to 2025 prescription drug coverage. These are the most significant changes in Medicare since prescription drug coverage was introduced back in 2006. We'll talk to you about the important implications these changes are having on your coverage and how you should be reviewing your annual notice of change as you consider your coverage for 2025. We'll touch briefly on Medicare enrollment periods and how to enroll in Medicare if you're not yet on Medicare. And importantly, we'll review for you what original Medicare covers, where the gaps are, and the two ways for you to protect your financial wellness and obtain coverage for the gaps in Medicare. We'll talk about why you would choose one way over another, and then we will review the Medicare prescription payment plan, which is also new for the 2025 year. Well, lastly, we'll review financial assistance for those on Medicare because there have been some changes there as well. All right, in terms of important terms, what should you be reviewing as you take a look at your plan and any potential changes for 2025? Well, the first is the plan premium, the amount you pay for either your Part B premium, your standalone prescription drug premium, your supplemental plan premium, and or your Medicare Advantage plan may now have a monthly plan premium. The premium, simply put, is the amount you pay for your insurance coverage, typically monthly. We'll review the deductible. Now, not everything has a deductible, but if your plan does have a deductible for a certain service or prescription, you must satisfy that deductible before the plan covers it. And your deductibles from 2024 to 2025 may be going up. Most people understand what a copay is. Quite simply, the copay is a fixed dollar amount for a service or a prescription drug. A lot of people get confused on coinsurance. Coinsurance works very similar to a copay. Instead of it being a fixed dollar amount like the copay, coinsurance is quite simply a fixed percentage that you must pay for a covered service or prescription. And that's alongside what the insurance company pays. We'll discuss the maximum out of pocket. The maximum out of pocket is the most you will pay for a particular service, and a maximum out of pocket is being introduced for prescription drug copays and coinsurance. We'll talk about the formulary. All the formulary is a big fancy word for a list of covered prescriptions. And we'll talk about some of the changes that you should be looking at for the list of covered prescriptions that your insurance company may have made. And lastly, we'll discuss how you should review your annual notice of change. The annual notice of change is a document that your prescription drug plan or Medicare Advantage company would have sent you prior to September 30th. For those that are on a supplement plan, your supplement plan generally does not send an annual notice of change. However, you may get at some point throughout the year, as you approach your anniversary date, a notice of a premium increase. When you're reviewing your annual notice of change, we want you to be reviewing, most importantly, the supplement or the summary page. Now, that summary page is usually a couple of pages after the table of contents. And that summary page is going to give you a high-level summary of any changes. You're going to want to look and see, has the premium for your plan increased? On an Advantage plan, has the maximum out of pocket changed? What are the cost sharing structure changes? Has the copay or coinsurance for a doctor's visit changed? Has the emergency room or urgent care copay changed? Have there been any changes to how an ambulance is covered or an in or outpatient hospitalization? You want to be reviewing the changes in any ancillary benefits through your Advantage plan. Are those ancillary benefits increasing, decreasing, or being eliminated altogether? And you're going to want to look to see if there's been any changes to the formulary, the list of covered prescriptions, as well as any network changes. If you're on an Advantage plan, is your doctor still in network? Now, I mentioned that we are reviewing the most significant changes in Medicare since 2006. What are those changes and how do they affect you? If you have ever heard of the donut hole, or what is called the coverage gap, is being eliminated for 2025. Now, for those of you hitting the donut hole, this is a welcome change. What is the donut hole? What is the change in prescription drug coverage? Let's review the 2024 coverage compared to 2025. Currently in 2024, there is an initial deductible phase as part of all prescription drug coverage. And this is the same whether you get coverage through an Advantage plan or standalone prescription drug plan. If your covered prescription has a deductible, you must first satisfy or pay that deductible before the insurance company covers your prescription. Once you've satisfied the plan's deductible, you move into what we call the initial coverage phase. During the initial coverage phase, if your prescription has a copay, a fixed dollar amount, you must pay that fixed dollar amount alongside whatever the insurance company covers. If your prescription has a fixed percentage, a coinsurance, you must pay that percentage alongside what the insurance company pays. Now, in the initial coverage phase, you continue paying your copays and your coinsurance until you and the insurance company have paid a combined $5,030 for your prescription drug coverage. And you continue paying those copays and coinsurance until you have reached that $5,030 limit. Once you and the insurance company have paid the combined $5,030, you move into the coverage gap, or what is commonly referred to as the donut hole. Once you're in the donut hole, you may have to pay 25% of the retail cost of your prescription drug coverage. And you continue paying 25% of the retail cost of your prescriptions until you and the insurance company have paid a combined $8,000. In 2024, once you've reached that $8,000 limit, you no longer have copays or coinsurance. When you go to the pharmacy to pick up your prescriptions, you no longer have to make a payment to the pharmacist. Here's what the 2025 changes are. Starting in January, we still have the deductible phase. You still have, if your covered prescription has a deductible, you still need to pay that. When you move into the initial coverage phase, if your covered prescriptions have a copayment or coinsurance, you continue paying that copay or coinsurance. However, once you have paid a maximum of $2,000 in copays and coinsurance, you move directly to the catastrophic phase and no longer have coinsurance or copayments. Once you have paid a maximum of $2,000, when you go to the pharmacy to pick up your prescriptions, you no longer have to make a payment. That's good for the folks that hit that level. Now, these changes, that limit has also changed the behind the scenes on who pays for your prescriptions. The insurance company's cost for your covered prescriptions has increased quite dramatically. And we are not seeing that the insurance companies are going to assume that increased cost by themselves. They are passing those costs on to you, the consumer. How can they pass those increases on to you? Well, they can quite simply increase your plan premiums. And we are seeing that by and large in standalone prescription drug plans. We are also seeing premiums increased or introduced, particularly to PPO plans on the Advantage side. What else are we seeing? We're seeing fewer plan choices. We know there are a number of Medicare Advantage companies that have left service areas. So for those folks, if your plan is no longer offered for 2025, you need to go out and find a new plan. On the standalone prescription drug side, we are seeing plans leave. We are also seeing plans merged into one plan to another. It's important for you to review your plans to see if you've been affected by either a plan being eliminated or a plan being merged, or what we call crosswalked into another plan. We are also seeing stricter formularies, or a change in covered prescriptions under one plan. We're seeing insurance companies reduce the number of prescriptions being covered. We're also seeing insurance companies increase what we call utilization reviews. Drug utilization policies are prior authorizations, step therapy, and quantity limits. So it's important for you to understand, has there been a prior authorization or step therapy being introduced to a prescription you're currently taking? That can affect your coverage or your ability to get that prescription filled come 2025. On the Medicare Advantage side, we're seeing changes in cost share structure. So you should review your annual notice of change to see if your copays for doctors and hospitalizations have changed. You should review your annual notice of change or your plan to see if there's been a reduction in the extra or ancillary benefits that you may obtain under a Medicare Advantage plan. Now, let's talk about enrollment periods briefly. Currently, we are in the annual enrollment period. It runs from October 15th through December 7th. That is an opportunity for you to make a change in your coverage. Now, if you enroll in a Medicare Advantage plan during the annual enrollment period, come January, you also have an open enrollment period. For those that are on a Medicare Advantage plan, you have a one-time opportunity between January 1st and March 31st of the year to make a one-time change. You can either change to a different Medicare Advantage plan, or you can go back to original Medicare, enroll in a supplement plan and a standalone prescription drug plan. Now, for those that are not yet on Medicare, your initial enrollment period for your Part A and B coverage runs 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and 3 months after the month of your 65th birthday. Now, if you don't enroll in original Medicare Parts A and B when you initially turn 65, you may have a special enrollment period. For example, if you're still working and delay your enrollment into Medicare, when you leave your employer group plan, you will have a special enrollment period. Now, if you delay enrollment into Parts A and B and you don't have a special enrollment period, you would enroll in Medicare Parts A and B during the general enrollment period, which runs from January 1st to March 31st. And you may have a late enrollment penalty if you don't enroll in Medicare when you first turn 65. Some exceptions to that are if you have creditable employer coverage, you may delay your enrollments in A, B, or A and B without being subjected to a late enrollment penalty. It is advisable to check with your employer or your insurance company to see if your coverage is creditable. How do you enroll in Medicare? How do you sign up in Medicare? By far the easiest way is on your through your online Social Security account. That is where you can enroll in Medicare Parts A and B. If you need to enroll in A and B and you don't have an online Social Security account, or if you don't have access to an online system, you can call Social Security and make an appointment with your local Social Security office. If you need to review your plans and make a change during the annual enrollment period, you can either call your insurance company directly, you can get on Medicare.gov and review plans, or you can reach out to an independent Medicare agent, somebody that can help guide you along the way. You could also use a SHIP or SHINE counselor who is a volunteer that can help you as well. Now, what is original Medicare? I think it's helpful, even if you've been on Medicare for years, to understand and revisit what Medicare covers, what Medicare does not cover, and how you, the consumer, can fill in the gaps of what Medicare does not cover. Now, your Part A coverage, for most people, that's premium free. You're not paying a premium for your Part A coverage. What's really important to know about Part A, and Part A covers hospitalizations, what is really important to know is that there is a $1,632 deductible per occurrence. Now, this is for the 2024 plan year. As of the date of this recording, October 19th, Medicare Social Security still has not released the 2025 figures. What this $1,632 deductible per occurrence means is if you are hospitalized overnight as an inpatient in the hospital, you may have a $1,632 deductible each time you're hospitalized. That's what the per occurrence means. Very important to understand that. It is not an annual deductible, it is per occurrence. What does your Part B coverage cover? Part B covers things like doctor's appointments, lab work, durable medical equipment, emergency room and urgent care visits. Now, there is a monthly premium for Part B. Currently in 2024, it's $174.70. 2025 figures have not been released yet. And your Part B premium may be higher based off of your income calculated 2 years prior. Now, Part B covers things like your doctor's appointments, lab work. What is important for you to understand about Part B, it's what we call an 80-20 plan. Medicare only covers 80% of your doctor's appointments, durable medical equipment, lab work, emergency room visits. There is a $240 annual deductible for 2024. After that $240 deductible, you're on the hook for 20% of your coverage, and there is no maximum out of pocket like there is on your employer group plan. You pay 20% of your doctor's appointments, and there is no stop loss, there is no cap. It is for this reason that I say Medicare is the intersection of your health coverage and financial wellness. Now, where are the gaps in Medicare? Well, the gaps in Medicare would be the Part A deductible, the Part B 20%. And original Medicare does not cover things like dental, vision, prescription drug coverage, hearing, and there really is no help under Medicare for long-term care. You have two options. There are two ways for you to fill in the gaps of what Medicare does not cover. The first way, option one, is a supplemental plan, a Medigap plan. Option two is a Medicare Advantage plan, also known as Part C. Now let's talk about these. First, let's review option one, original Medicare with a supplemental plan. Under this option, you have original Medicare Parts A and B, and you can add a supplemental plan that can cover things like the Part A deductible in the Part B coinsurance. Now, if you choose this option, what's really nice is you can see any doctor, any facility across the country that accepts Medicare. It does not matter who your Medicare supplement insurance company is. Each plan in each category offers the same coverage, and again, you can see any doctor, any facility in the country that accepts Medicare. Now, if you choose option one, you have original Medicare with a Medicare supplement plan. You should also get a standalone prescription drug plan, Part D, and you may want to add an optional dental plan and an optional vision plan. So under option one, you are paying a premium, your Part B premium to Social Security. You're paying a premium to the Medicare supplement Medigap company. You're paying a different premium, perhaps to a different insurance company for your Part D drug coverage. And if you choose for optional dental and vision, you may be paying a separate premium to two separate insurance companies. So you may have 5 different monthly premium payments you're making. However, you do have excellent coverage in that your copays and your cost structures are limited under the Medicare supplement plan option one. Once you make that monthly premium payment, that supplement plan is going to cover the Medicare Part A deductible, the Part B deductible, or the Part B coinsurance, depending on the level of supplement plan you enroll in. All right, let's say, what's the other option? Option two. This is the Medicare Advantage plan, otherwise known as Part C. Now, the Medicare Advantage plan has HMO and PPO doctor networks. For this reason, it is important for you to review your doctors and make sure they're in network. The Medicare Advantage plan has a series of copays. Instead of paying, most Medicare Advantage plans have no upfront monthly premium, but instead you have copays for when you use the plan. You may have a copay for a specialist visit or a hospitalization or surgical procedure. Many Medicare Advantage plans wrap up ancillary benefits all into one plan, so you can get all of those optional coverages built right into your Advantage plan. So the question becomes, which way do you go? If you're still working, do you stay on your employer group plan? If you're still working, or if you're no longer working and you go on Medicare, should you enroll in a supplement plan, or should you go the Advantage route? Keep in mind, retiree coverage and COBRA are not considered creditable under Medicare. So if you have a retiree plan or COBRA, you should really consider enrolling in Medicare and taking a look at either a supplemental or Advantage plan. Let's talk about your employer plan first. If your employer plan is creditable, and you should check with your employer or your insurance company to verify whether or not your plan is creditable. The considerations for a creditable employer plan or to switch to Medicare are typically what is your annual income? Because if your annual income is such that you'd be paying a higher premium, you want to compare that higher Part B premium with the premium for your employer plan. Do you have a younger spouse or other dependent on your employer plan? Because if you leave your employer plan to join Medicare, you now need to consider what the cost and coverage is for that dependent. And currently, brand name prescriptions may have more favorable coverage under your employer group health plan. It's important to do a cost benefit analysis to compare and contrast each and to take a look at what coverage is most affordable and provides you with the most adequate and comprehensive coverage for your personal situation. All right. You've either determined that you don't want to be on your employer plan or you don't have access to an employer plan. You're enrolled in Medicare Part A and B. Now the decision becomes, should you go with a supplemental plan or an Advantage plan? And in my opinion, we typically advise our clients who want to budget their medical costs over the year to enroll in a supplement plan. If you have a chronic illness, a chronic disease, you're predisposed to routine frequent care and/or routine frequent hospitalizations, usually a supplement plan can work out to be the most affordable for you. And again, you're smoothing or budgeting those costs over the year through monthly premium payments instead of monthly copays or coinsurance under an Advantage plan. If your doctor is not in network, you live in multiple parts of the country, you live in a rural area where you don't have access to care, you do not like the doctor network, the supplemental plan can be a really good option for you because you no longer need to worry about those HMO or PPO networks. You can see any doctor, any facility in the country who accepts Medicare. It gives you a lot of flexibility and a lot of freedom. So who should be on an Advantage plan, or who should consider an Advantage plan? Somebody that wants to pay a lower premium or no premium, someone that is in relatively good health and does not use the health services regularly, but understand how your cost structure is designed under an Advantage plan, understand what your maximum out of pocket or what your stop loss is should something happen. Review your doctors to make sure they're in network. While you can go out of network on a PPO plan, you will pay more. So you do want to try to get all of your doctors or the majority of your doctors that you frequently see within network. You like access to ancillary benefits, or you want to wrap all of your benefits up into one plan rather than paying 5 different insurance companies. The Advantage plan can work well in that situation. All right. New for 2025 is this prescription payment plan. For those that are hitting the coverage gap or the new $2,000 maximum out of pocket, this prescription plan may be of interest. It is voluntary. If you want to enroll in it, you have to opt into it with your insurance company. And this is available to anybody on a Medicare Advantage plan with prescription drug coverage or a standalone prescription drug plan. If you enroll in the prescription payment plan, you will not pay the pharmacy your copays. Instead, your insurance company will send you an invoice and you will have to pay your insurance company or your insurance company's pharmacy benefits manager. You will have a monthly payment arrangement, and that monthly payment arrangement is going to change throughout the year based off the prescriptions you get filled at the pharmacy. Who should consider opting into this plan? Again, those who have higher copays or deductibles earlier in the year in January, February, March, and you want to try to expand those payments out throughout the year, those folks may want to consider this payment plan. However, do know that your monthly payments are going to change throughout the year, And what we've seen when we've illustrated this out for a few clients already is that their costs during the beginning of the year may be lower, but they may have some extremely high costs at the end of the year. So be careful and seriously review what the impact throughout the year may be if this is a plan you're going to consider. If you want to consider this, you should contact your insurance company and have them help you understand what your potential payments throughout the year may look like. I do want to take a moment to talk about Medicare savings programs. This is another change that actually was introduced in March of 2024. For Medicare savings programs, there used to be an income plus asset limitation. The asset limitation has been removed. So for some people who have applied for this program or considered this program in the past and did not qualify because they had savings or retirement accounts, you may now qualify for this program. For example, if you're a Massachusetts resident and you file your taxes individually, if you have income of $2,824 or less, you may qualify for the Medicare Savings Program. You may qualify for a program that will rebate or pay your Part B premium on your behalf. It may cap your prescription drug costs, and it may also cover the coinsurance and copays under your Part B coverage or your Medicare Advantage plan. So if that is you, if that is your situation, you may want to look into that as a means to save money. What do you do next? Here are the questions to ask yourself. As you review your current plan and your annual notice of change, will your plan still be offered in 2025? There are a number of plans that are being completely eliminated, and there are the others that are being merged together. It's important for you to know that. And if that's your situation, it may be to your benefit to review those plans and to consider whether or not you need to make a change. Is your monthly premium increasing? Well, if your monthly premium increasing, is there another plan with a lower premium that would cover your current prescriptions at a lower cost? Are your drugs still covered by your current plan, and at what cost? We know there is one prescription drug plan that is no longer covering brand name insulins. If you're a diabetic taking brand name insulins, you really need to review your plan to make sure that you will still have coverage. If you're on an Advantage plan, what ancillary benefits have you been using? Are they still offered? Have they changed? Have they increased, decreased, or been eliminated? It may benefit you to schedule a meeting with a professional to review your plan needs. Independent Medicare brokers, you do not pay an independent Medicare broker. Independent Medicare brokers are paid by the insurance companies, and you get the same plan whether you talk directly to the insurance company, whether you talk to a volunteer SHIP or SHINE counselor, or whether you talk to an independent Medicare plan advisor, somebody who is independently appointed by multiple insurance companies. We would love to work with you. We would love to help guide you along the process and help you understand your plan and any changes. The decisions you make today can impact your coverage for a long time. Medicare is the intersection of your health coverage and financial wellness. Reach out today to create a partnership for your health and financial wellness. Until we talk later, be well and be healthy. Thank you.